Hello, everyone, and thank you so much for joining me for today's lecture. Today, we are going to look into a scientific assessment of clinical trial data. So, why we talk about science? That's because we need to do experimentations. And when we talk about scientific assessment, we are talking about using a systematic approach in order to look into the data. And when we repeat an experimentation or a trial, we need to find, I would say, data that will confirm to some extent the previously gathered data from other experimentation. So that's why we talk about science. It means that you can repeat the experimentation and you're going to find the same results or conclusion. Obviously, in clinical research, we are dealing with humans, and in humans, we do have also genetics and we have genetic predispositions. This means that when we are looking into the safety and efficacy of a new drug or a new procedure, it's obvious that we may not have the same extent of response from the human subjects to the treatment. We know very well that based on the statistics, observations, that experience adverse drug reactions. This means any untoward medical occurrence experienced by, again, people, subjects who are in a trial. Why? That's because about 10% of people, and just I'm talking about just one parameter, which is about metabolization rate. I don't go over the again, absorption, distribution, or excretion, but just for the metabolization rate, talking about pharmacology, we know that we have ultra metabolizers and we have poor. Again, use the internal functions of Excel or any other database or statistical tool in order to compare the data before the intervention or the treatment and after the intervention. And of course, for this case, we would use a paired t-test. But for the sake of this presentation, I'm just asking you to learn about how to add the data, clinical data, how to create the graphs, and then how to explain what you see in the graphs. Okay, so here, of course, I gave the example of what we can write. I can even make it larger so that, again, you can see what is written. For example, for this graph, again, we are not doing any statistical analysis. What we do is just to create those bar charts. And then we are, of course, giving the title of this graph. This is the effect of treatment on systolic blood pressure per patient. So here we have the data for each patient. This is the data visualization before and after. So in orange, this is after. So what we do first is that we're going to look into each and every patient, and we are going to see how the drug tend to work. And we are going to explain that here. For example, for this graph, what we write is, observing the graph, it's possible to confirm that there is a decrease in systolic blood pressure after treatment for all patients and suggests that the treatment is effective in reducing hypertension. Before the treatment, the average systolic blood pressure is approximately, and here you give the number, while after the treatment, it's approximately what number. And don't forget, here the person didn't write that, it should be in the correct units. It's millimeter of mercury. The difference between these averages, which is the average change in systolic blood pressure after treatment, is 22.17 millimeters of mercury. So also before treatment, the standard deviation is approximately 10.76 and after approximately 9.28. Therefore, after treatment, the data are less dispersed in relation to the average, suggesting more consistency in the response to treatment among participants. And in summary, If the blood pressure decreases significantly for the majority of participants, the drug can be considered effective. However, if there are a few individuals with minimal changes or a rise in blood pressure, more personalized treatment plans to adjustments may be needed. So when we look into the explanation for this graph, we have to refer to the left side here, talking about, I would say, no, where we can see the data itself. And not just with the data, but also with the measurements. Because what we did for this, I would say, spreadsheet is that we extracted the data from the very first spreadsheet. This one, we extracted the data. We took patients' IDs. We also took systolic blood pressure before treatment and systolic blood pressure after treatment. So we took this column, and of course this column, these three. And then we added those columns into a new spreadsheet here and here and here. And then we calculated the average and the standard deviation. For the average, for example, you can use the internal function of Excel. Please, again, refer to how to use Excel and how to add those functions in order to, again, measure the average or the standard deviation in Excel. So the data that we see, the individuals' data that we see here, they are all explained and, of course, described here on the right side of this Excel spreadsheet. So what we need to do as a step in scientific assessment is to look into the data. Obviously, after the data is observed, we will decide on what statistical test we will need to again use in order to see if there is a real difference in between the effect of the drug after the treatment compared to no use of the drug before the treatment. So that was in a nutshell what is needed to be done. Now coming back to the spreadsheet that we also have a second question. Okay, the first question was, what is the effect of treatment on systolic blood pressure? Another question that we have is, what is the effect of the treatment on diastolic blood pressure? So we are going to do exactly the same. This time we are going to create a spreadsheet, and here we are going to add for the first column the participant's ID, and then we will add the column for diastolic pressure before the treatment and the diastolic pressure after the treatment. So here we are going to create another spreadsheet, which is here in the second tab, and this is what we observe. So I'm going to now show you what we have done. Is that, again, we looked into the participant ID, we added the, diastolic blood pressure before and after the treatment. Again, you can also look into the changes individually, but we need obviously to look into the graphs for the individual patients and then to write down again the conclusion of the observations from this very, I would say, step in the scientific assessment. So again, don't forget to learn about Excel and then to be able to calculate the average and to calculate the standard deviation that are needed in order to again calculate these variables in this spreadsheet. And again, the next task for the sheet that we see here is to look into the effect of treatment on blood oxygen level. So here, first again, we will need to create another blank database, spreadsheet, and then on the spreadsheet we are going to add column A for the participant ID, and then we look into the blood oxygen level before and after the treatment. So we are going to have this type of data, and we will now need to look into, again, the average, and then to the standard deviation. And then what we observe here, for example, is that the blood oxygenation level is higher after 1 month of treatment with our experimental anti-hypertensive drug. So what you're going to do, of course, is to now do the graph here, and then to write the comments related to the observations. So now the next question that we have is the effect of the treatment on the breathing rate per patient. So here again, we are going to create another spreadsheet in graph 4, of course, and then we are going now to copy this participant's ID, and then the breathing rate, so then the colon K and the colon L. So what we have now is this, the columns that we have. Perfect. So here again, as you see, we are adding the ID, breathing rate after and before. And then what we observe is that the breathing rate is now lesser after the treatment. And here we have the standard deviation. Now you will need again, as a step in scientific assessment, to look into the the graph for each of the patients, and then to write a conclusion describing, of course, here the again the your observations related to the data that you find. Now coming back again to the sheet, the first sheet, we are now also interested in the effect of the treatment on quality of life. So here we create another spreadsheet with the participation or participant ID, and then we are going to also add the overall quality of life before the scores before the treatment and after the treatment. And then we will now look into the graphs, and we are going to again add those graphs. Now here what is also interesting is that we are looking into females, for example, population, and the male population, because what we are looking at here is to see if there is any difference in between genders when we are using our drug. Okay, so obviously we also need to write comments for every of these graphs that we observe. So overall, what we understood from today's lecture is that we are looking into a scientific assessment of clinical trial data. So first, we need to go through the good clinical practice, ICH GCP, because this is mandatory that we, again, we are in full compliance with ICH GCP in any country. When we have, again, our protocol, we have to make sure that our protocol has, again, several sections as per ICH GCP or good clinical practice. We also need to have an informed consent that we have to prepare right based on the study. We have to make sure that each and every patient is going to go through the informed consent process, and they understand the risks and benefits of the experimentation on using the experimental drug. They also need to know about the rights, that they can always stop at any time. There is no penalty. Of course not. They are free to start and free to leave at any time. We also make sure that we are having our case report forms, or those web interfaces or papers, I would say, that allow us to document the data that we gathered. Because if we are not documented, it means that it never happened. We need to document everything. Then we will need to go through, again, the analysis of the data. First, we learn about the data. Then we are going to use spreadsheets in order to visualize the data. We also use the spreadsheets in order to look into the average for each group, and then look into the standard deviation. Then we are looking into creating tables and graphs in order to see individual and of course having individual data, but also to look into having a better idea about the overall also the group of patients results. And then obviously for going further, we are going to look into again the distribution of the data that will allow us to choose the type of statistical test that we are going to use. And as I already mentioned, if the distribution of data is normal, so we have a normal distribution, then we can use parametric tests such as paired t-test or student test. If not, if we are having a normal distribution, in this case, we will need to use a non-parametric test like Wilcoxon test. So once we have established, of course, the averages and standard deviation, and then we also compare the results for each of the variables before and after the treatment, then we will be able to conclude by saying that based on the statistical test that we used, our hypothesis is true. And obviously, for the sake of this presentation, we have been looking into testing the efficacy and safety of our experimental drug. So I just want to thank you so much for, again, joining me today. I hope that you enjoyed the content of this presentation that was related to, again, the scientific assessment of clinical trial. So thank you so much, and have a good day.